Hello, my name is Beth Dean. I'm a physician assistant with the Hartford Healthcare GoHealth Urgent Care. As the winter months are approaching, we'd like to reach out to the community with some important information regarding influenza, more commonly referred to as the flu. The flu is an illness caused by influenza A and B viruses. The flu occurs in outbreaks and epidemics, which typically occur in the winter months of the northern and southern hemispheres. Tropical climates experience the flu year-round. The United States Center for Disease Control and the World Health Organization work in collaboration to track and monitor the influenza virus to predict the virus isolates for the annual vaccination. During this video, we'll answer some important questions about influenza. How do I get the flu? What will I experience if I contract the flu? How do I know if I have the flu? How is the flu treated? What should I do if I get the flu? And how can I protect myself and my family from the flu? How could I get the flu? The flu is transmitted via respiratory droplets from sneezing and coughing. Respiratory droplets can travel up to 6 feet in the air or contaminate surfaces like doorknobs and the handles of a sink. Incubation is 1 to 4 days. This means the number of days between a patient getting infected with the flu and when they begin to show symptoms. Patients infected with influenza can shed the virus in respiratory droplets 24 to 48 hours before they show symptoms. What will I experience if I contract the flu? The flu is known for an abrupt onset of fever, muscle aches, headache, and malaise. Most of the time, patients can tell us exactly when they started feeling sick. This is how suddenly the symptoms come on. Associated symptoms include sore throat, cough, and nasal congestion. Fever is typically 100 to 104 degrees Fahrenheit in adults and maybe even higher in children. Elderly patients tend to have more subtle symptoms, including anorexia, malaise, weakness, and dizziness. Occasionally, gastrointestinal symptoms of nausea, vomiting, and diarrhea may occur. However, this is more frequently experienced in the child population. Otherwise healthy patients without complications typically notice an improvement of symptoms in 2 to 5 days. However, symptoms of the flu may last up to 10 days. The most common complications of influenza in the adult population is pneumonia. Complications in children include pneumonia, otitis media or ear infection, croup, febrile seizures, and possibly meningitis. How do I know if I have the flu? Luckily, most common viruses that cause upper respiratory infections during the winter months are the rhinovirus and coronavirus. However, we do need to be able to decipher between the common cold and influenza to protect ourselves, our family, and other community members. There are 2 ways to diagnose the flu. Clinical diagnosis is made by your medical care provider, and a laboratory diagnosis is the result of a test. During an active influenza outbreak, testing is not needed for otherwise healthy patients. A high degree of certainty can be used to diagnose the flu with the presence of fever and respiratory illness. This is called a clinical diagnosis that is made by your healthcare provider. A study of nearly 4,000 patients showed fever and cough within 48 hours of symptom onset had the best positive predictive value of a positive influenza test. The question then arises, is influenza testing appropriate during the flu season? Here are some reasons. If the test results will influence the management decision, meaning does the patient need antivirals or antibiotic medication? If the infection control precautions will be impacted by the results of the flu test, it should be completed. If immunocompromised patients has a fever or a respiratory illness, the flu test should be administered. If an immunocompetent patient is within 5 days of onset of fever and respiratory illness and is at very high risk for a complication from influenza, then the test should also be done. Hospitalized patient with fever, respiratory illness, and community-acquired pneumonia should receive a flu test. Patients who are recently hospitalized and develop fever and respiratory illness should also have the test. Testing is also important for providing local surveillance data. The rapid antigen test is the most readily available outpatient test in the urgent care setting. Influenza A and B viruses can be detected in 15 minutes or less, which is quite convenient. Like all tests, this test is not perfect and false negatives can happen. That's why during an outbreak, it's important to talk to your healthcare provider about clinical versus laboratory diagnosis. The timing of the test is extremely important. Viral shedding peaks 24 to 48 hours after the onset of symptoms and then begins to decline. After 5 to 10 days, the test is significantly less likely to diagnose influenza. 2 important caveats to note regarding the influenza testing. First, treatment should not be delayed waiting for test results. And second, treatment should not be stopped for a negative rapid flu test. How is the flu treated? Despite how miserable the flu makes you feel, in most cases it's self-limited, meaning it will resolve without intervention. Two types of treatment are symptomatic treatment and antiviral therapy. Symptomatic treatment is used to make you feel better. Examples of symptomatic treatment include acetaminophen and NSAIDs, like ibuprofen. It's very important to remember that salicylates should be avoided, especially in patients less than 18 years of age because of the risk of Reye syndrome. You can discuss with your healthcare provider other medications that may be targeted at the treatment of other symptoms, like cough, nasal congestion, or nausea and vomiting. Antiviral therapy is a medication targeted at a virus. It's important to remember that influenza is a virus, and an antibiotic that treats bacteria will not help. Antiviral medications are available and may be appropriate in certain circumstances. It's most important to have the appropriate expectations for antiviral medications. They do not work like antibiotics. When started within 24 to 30 hours of the onset of symptoms, antiviral medications can decrease the duration of illness by 12 to 72 hours, and also reduce viral shedding. When started more than 48 hours after the onset of symptoms, it's very unlikely that antiviral medications will change the course of influenza. Antiviral medications for the flu are recommended for patients who are severely ill, hospitalized, or at high risk for complications. Patients in that high-risk group include nursing home residents, adults aged 65 and older, women who are pregnant or up to 2 weeks postpartum, patients with chronic medical conditions, including asthma, malignancy, cardiovascular disease, HIV, and blood disease. Otherwise healthy patients less than 65 years old presenting after 48 hours of symptoms of the flu are likely not to benefit from this medication. Oseltamivir is the most typically prescribed medication for the flu because it's an oral medication that is effective against both influenza A and influenza B viruses. The most common side effect of this medication is nausea and vomiting, although more serious side effects have been reported. What should I do if I have the flu? If you've been diagnosed with the flu or suspect you have the flu, do your friends, family, coworkers, and community a favor. Stay at home. Influenza spreads rapidly, and you can readily infect those around you. It's often difficult to tell if the woman sitting next to you at a sporting event is early in pregnancy, if the child in line next to you at the grocery store suffers from severe asthma, or if the elderly person in front of you at church may be being treated with chemotherapy treatment. If you must be out of the house, it's best to think of those around you and wear a mask. What can I do to protect myself and my family from the flu? Vaccinating yourself and your family members against the flu will help to reduce your chance of getting the flu and also reduce the severity of illness if you do contract the flu. During the 2017 to 2018 influenza season, the CDC recommends inactivated influenza vaccine injected intramuscularly for all patients 6 months of age and older. The high-dose inactivated influenza vaccine has been shown to be more effective in patients 65 and older. Patients 3 to 36 months of age receive a different dose than children ages 3 and older. Adults living in the Northern Hemisphere should receive influenza vaccine before the end of October annually. The most common side effect of receiving the flu shot is arm soreness, which typically occurs in 64% of patients. A low-grade fever may occur after receiving the vaccination, but it typically occurs in children under the age of 2. Patients who are allergic to chickens or egg protein should still receive the inactivated influenza virus vaccine, however, in a setting with a healthcare provider experienced to recognize and manage severe allergic reactions. Influenza vaccination can be administered at the same time as other immunizations, just in a different location. Now we'll show you how easy it is to receive your influenza vaccination. Hello, are you Lucy?
Yes.
I'm Beth. I'm a physician assistant. It's very nice to meet you.
Nice to meet you too.
You're here to get your flu shot today?
Yes.
Okay. Have you had the flu shot before?
I did.
Have you ever
last year?
Oh, good, good. Any reactions to the flu shot in the past?
No reactions.
Are you allergic to eggs or chicken products?
Not that I know of.
Okay. So your arm might be a little sore tomorrow. Are you right-handed?
I'm right-handed.
So let's use your left hand. Is that okay with you?
Okay. Yeah,
all right.
perfect.
Clean the area here. Any questions?
No further questions.
Okay, just keep your arm nice and relaxed. Big pinch. It's all set.
All done?
You did a great job.